First on our agenda, we have a COVID-19 update. We have Mr. Bill Webb, our health officer here in Kent County, and Wayne Darrell, our director for emergency services. So Mr. Webb, the floor is yours.
Thank you, Mr. Mason. I also want to thank the commissioners for this opportunity to address the community. I want to also acknowledge the cooperation and support that we have gotten from everyone in the Emergency Operations Center, and that covers most of our local government and our nonprofits. I'm grateful for their participation and their ongoing cooperation. Okay. Forgive me for reading the statement.
That's fine.
I'm pleased to report that this month's report will build on the positive one I presented in August. On Friday, September 4th, 2020, the state officially entered Phase 3 of the Governor's Roadmap to Recovery. Performing arts, movie theaters, and professional sports are now permitted to operate. Bars and food service establishments had their restrictions further lifted on September 21st. The governor took this action in response to declining metrics statewide. Daily case rates, positivity averages, and hospitalizations are down. Parallel to this, Dr. Salmon at the Maryland State Department of Education released detailed guidance on reopening our schools. She urged local boards of education to reopen classrooms as soon as safely possible. In Kent County, conditions have not merited restrictions greater than those imposed by the governor. This has been true since the start of the crisis. We are reopening and making the gradual march to normalcy. COVID-19, however, remains active in Kent County. As the next slide illustrates, we have had 49 cases since my last presentation. Currently, there are a total of 7 active cases and 297 have been resolved. 26 of the cases are attributable to the general community spread, and the remaining 23 are tied to facilities and educational institutions. The most prominent feature worth noting in these cases is the demographic of those infected. We have seen the virus shift aggressively into the young adult population. That is defined as those between the ages of 18 and 29 years of age. This trend is mirrored across the state. Many of the infections have been linked to the resumption of colleges and universities. The good news is that most of these individuals who are infected recover without needing advanced medical care. Washington College, it is worth noting, successfully handled an outbreak among its students earlier this month. I take this opportunity to commend their efforts and their ability to execute their thorough plan of action. Deaths in the county attributable to COVID unfortunately increased by 1 in the last month. The next slide illustrates the number of new cases in the last 14 days. We have had 15 total cases, which averages about 1 a day, a little over 1 a day. The next slide after that presents case totals broken down by zip code for those who may be interested. The positivity slide, which can be seen next, Kent County's rates have been consistently below the state's average since July 21st. The blue line is the statewide rate, and the pink one is Kent's. This graph is important because it illustrates one of the 2 metrics that are driving decisions related to school reopening. Please note that we have been below 5% positivity since the middle of June. The second important metric that I want to mention is on the next slide. It is the COVID case rate per 100,000 population. Once again, the state averages are in blue and Kent's in pink. The state started publishing this information on August 28th after announcing that this number will drive decisions related to school reopening. On this slide, Kent's numbers fluctuate considerably. The fluctuation really is an artifact of our small population. One positive in Kent has a disproportionate impact on this rate when compared to larger jurisdictions. On this slide, it is important to note that our case rate has been below average for 90% of the days for the last 2 months. As it relates to school reopening, a case rate below 15 per 100,000 is what's needed for a return to in-person learning. Given Kent's low positivity rate, its moderate case rate, and our available hospital capacity, Kent County has met the metrics to gradually resume in-person learning. Dr. Couch and the Board of Education have a comprehensive plan for making this happen. Just yesterday, pre-K students returned to the classroom along with a limited number of students who had trouble with remote learning. The governor has approved the return of interscholastic sports starting October 7th. The Kent County Health Department endorses Dr. Couch's plans for a gradual return to in-person learning for our students. The next slide illustrates the success that Kent has had getting its population COVID tested. We have the 3rd highest rate in the state. Our team at the Chestertown testing site has been averaging 150 tests a week. University of Maryland Shore Regional Health assists with its site at Chesapeake College. At this point, at least 1/3 of our population has been tested at least once. On a different note, I'm distressed to report that the Maryland Department of Health has forced the Kent County Health Department to switch our lab providers. Unfortunately, the new lab provider has a longer turnaround time for test results, approximately twice as long as we have become accustomed. Starting October 5th, citizens can expect COVID test results to be returned in approximately 4 days. So, the next slide. During contact tracing, the health department frequently reaches out to individuals who have no idea they have been exposed. For every positive we identify, there are an average of 2.6 contacts. Frequently, we experience difficulty getting people to answer their phones when a call originates from an unknown number. I implore all citizens to take any calls from MD COVID. This is the health department calling. We want to keep you and your family safe. Please pick up. Contact tracers, as a reminder, will never ask for social security numbers, passwords, credit card information, or require payment to get results. If you are a parent of a school-age child, please keep your phone number up to date with their school. The next slide is some additional details about contact tracing. It illustrates that in Kent County, high-risk gatherings and locations include family gatherings, work outside the home, indoor restaurant dining and retail shopping, and also outdoor recreation. Although not immediately listed, the highest risk setting continues to be the home. Those who live with an infected individual is at such a high risk we frequently advise exposed family members to quarantine until their test results can be obtained. The majority of community spread occurs through those who cohabitate. So if we go to the next slide, please. As we move forward, the health department faces 4 significant challenges. The first is with school health. Resuming in-person education is the top priority. The plan for a gradual and organized re-entry is optimal. At this point, we need to train the health department staff and the school staff on our Outbreak Response Act practices. We need to integrate COVID best practices with our everyday school activities. This will take sustained effort and bear repeating. Just as my teachers had to remind me to tuck my shirt in, I have a feeling teachers today will be asking their students to pull up their masks. Our second challenge involves maintaining the testing and contact tracing programs. Funding for these programs will expire on December 30th. We know demand in the new year will continue. How we will pay for that is unknown. Third, we need to prepare for a seasonal surge in COVID and flu. We are expecting that and hoping that we can keep it to an absolute minimum. The health department will be holding flu immunization clinics on the dates and locations listed on the slide. I encourage all citizens to get a flu shot. This small act can reduce demand on our healthcare system down the road. Our fourth challenge is to prepare for a county-wide COVID-19 vaccination effort in the new year. Certain segments of the population will receive immunizations ahead of others. It will occur in phases and likely require each individual to receive multiple injections. COVID vaccination will be a heavy logistical lift. To run smoothly, we must start planning now. Finally, the last slide provides a summary update on our CARES Act funding. This summary involves the public health half of the grant. A detailed report was sent on the 25th. If you need a copy, I have those available. To date, we have spent $380,000. We plan for 1.6 million and have a remaining balance of 1.3 million, which must be committed by December 30th, 2020. I am hoping that the federal government will permit rollover of unspent funds into 2021. In closing, Kent County currently sits in a fairly good position relative to our neighbors. I'm grateful to be a citizen of Kent County and the way our community has responded to this emergency. I caution everyone not to become complacent. The COVID virus is outside, ready to spread mercilessly if we allow it. Our community's success will rest with the actions and personal responsibilities everyone takes. I urge all to please continue to wear masks, stay at home if you're at high risk, wash your hands, and keep your distance while socializing. Your efforts make a difference. These measures work. Thank you.
Thank you, Mr. Webb. I do have a question on the clinics for the flu shots. Is there a cost to the community for that, or?
There is, and most insurances cover it. And it depends on which shot you get. If you're older, there's a high dose, which is a little bit more expensive, but the health department is able to handle Medicare and Medicaid recipients, so that there would be, for those folks, there would be no out of pocket.
Okay.
So if I wanted to go get a flu shot, is there a place where I'm finding information on where I could go?
Yes, if you go to the Kent County Health Department webpage, that has the 3 dates listed. If you can't make any of those, those 3 drive-through dates, your primary care provider will offer it, pharmacies will offer it, and once we're finished with the clinics, the health department will also have by appointment as well.
I'd also like to offer that October 1st, the county is sponsoring a flu clinic at the Public Works for employees, dependents, and we also offer that to like Chestertown and the courthouse and everything. So, and it's covered by our insurance, so it's October 1st at the Public Works.
Well, now, that's in addition to the one October 16th.
Correct.
Yes, that's sponsored by the county.
That county.
And that's specifically for Kent County government employees.
And is it the employees and their families?
Yes, and we opened it up to Chestertown, and like I said, the courthouse, we send them an invite as well.
Okay. Okay, is there any other questions for Mr. Webb? Once again, we appreciate everything you've done. I think the results and what we see here in our county speaks to the job that you and your department has done, and what Mr. Darrell and his department has done, and also to the cooperation from our citizens. it has to be a working together to make it all work. It's just,
Exactly.
it's the way it is.
It's a reflection on the community more so
Yes.
than the health department.
Okay. Thank you.
Okay, thank you.